And here's the deal. The state is facing a $4.5 billion budget deficit. Okay? It's the highest deficit that the Commonwealth has had in its history. And the thing that makes it so much more difficult is the fact that the state has a very high unemployment rate. Okay? State's unemployment rate is 8.6%. Now, the only thing good about the fact that it's 8.6% is because we're better than every state around us, and we're better than the national average. The national average is like 9.8% to 10%. The states around us are in the same area, but we're 8.6%. So we got better numbers than everybody else. But that still is not good enough because we still have 8.6% of the people in the state of Pennsylvania who are unemployed. And the truth of the matter is, and all of you know this, in many pockets in our community, those numbers are twice that, 3 times that, 4 times that, 5 times that, okay? Certain areas in our neighborhoods, certain areas in our communities, the unemployment issues and the unemployment rates are 40, 50%, okay? Because you can't find a job, you can't find work. So anybody who's working, first and foremost, personal message, if you got a job, keep it. Come to work on time. Do what your boss says for you to do. Okay? Be cooperative. Smile a lot. Okay? Help everybody else out. You don't want to be in the business of losing your job. Okay? Because it's not like there's a whole bunch of others out there for you to get. Okay? So just little tidbit of information there. So we got a $4.5 billion budget deficit. So just lock that in. Now here's the crisis that we confront. I'm going to make this clear. You need to write this down. This document will go through some of this, but, pull out a piece of paper and just make some notes right now. We have a $4.5 billion budget deficit. The state's budget is ballpark about $28 billion. We have a $4.5 billion budget deficit, and the reality is that about 80% of the state's entire budget, about 80% of that $28 billion is pretty much locked in expenditures. In other words, it's money that has to be spent, if you follow what I'm saying. So that's about 80% is locked in. Now, Senator, what do you mean by locked in? All right, let's walk through it. The largest chunk of that is essentially money spent in medical assistance in the whole Department of Public Welfare program structure. Okay? Everybody knows what that is. Okay? That's nursing homes, that's health care services, that's child care services, that's all that whole spectrum of programs and services that are provided largely through the Department of Public Welfare. That's provided to folks who are in need. Seniors having to go into nursing homes. We've got to provide for them. Folks who are low-income individuals are in the medical assistance program. What does that mean in our region? That's Keystone Mercy. That's Health Partners. That's AmeriHealth, AmeriChoice. You all are familiar with those names, okay? That's where folks who are locked into those programs, and that provides them their health care, all right? Mental health services, okay? Child care services. Now, those dollars, and it goes on and on and on and on, are essentially locked in. They're matched in many respects, not in all. In many respects, they're locked. They're matched by federal dollars coming in, but it's required services for the Commonwealth to provide to people. All right, and with the recession, it puts us in a situation where more and more folks, Sister Gladys, are utilizing those programs. Because you all know in your community, you see what's going on in your community. Folks are not working, so they got to get help from somebody. They got to get help from somewhere. And this is what the state provides to provide them some assistance. So that's, in a nutshell, the Department of Public Welfare. Then you add on top of that education spending. And that's essentially money going to our schools. All right? that money is locked in. When I say that money is locked in, I mean, there could be some wiggle room in that area. But the real deal is that if you cut back the money coming to public education, which I think is the wrong thing to do, we have to invest in our children. We have to educate our children. They don't get an education, they have no future. But if we don't invest in the education of our children, we don't put the money in from the state side, what will happen is it will be made up by local tax increases, property tax increases at the local level. You follow what I'm saying? Okay? So if the dollar was X and we take 10% of X out from Harrisburg, and that gets cut short from Harrisburg, then the local community, not wanting to lose any money, will raise taxes up on a local level to fill a hole. Everybody follow that? Okay? So then you have that. So that's kind of locked in spending there. All right? And then you have what's going on in our whole correction system. Okay? The cost for corrections has been going up like this every year. Not staying the same, not a small increase, but an increase that's going up like that. Okay? That's solely largely a result of the fact that, 9 years ago, the General Assembly in Harrisburg under the previous governor, which is Tom Ridge, put in a whole bunch of laws in what was called a special session on crime. Put in a whole bunch of laws that was basically lock folks up and throw away the key. Okay? You might remember the whole concept of 3 strikes, you're out. And everything that related around that concept. Okay? I didn't vote for any of that stuff, just to set the record straight. Okay? All right? I was a no on just about everything that was going through in the General Assembly at that time. But it became law. And what happened is that the incarceration rate went up. New prisons had to be built to house these folks. In fact, the number of folks who became incarcerated during state time, not local time, but state time, was so large that we had to start shipping people outside the Commonwealth of Pennsylvania and housing them in prisons in other states. I want to say West Virginia and Michigan. Is that right, Randy? Or those are Virginia, and Michigan. Okay. Now, fortunately, in the last year or two, we've tried to put some measures in place to kind of slow that down a little bit. Okay, and try to put the brakes on that, and so but putting the brakes on that requires us to be sensitive in our own communities. Okay, because what it really means is taking those individuals who are nonviolent offenders. Okay, folks who haven't hurt anybody physically, nonviolent offenders, and maybe we have to put them in facilities in our neighborhood. Okay. And sometimes, we're not very sensitive about that kind of thing. You understand what I'm saying? Am I making myself plain? Sometimes we can, put it over there, don't put it in my backyard. Put it in their backyard, okay? And that requires us to be the better part of ourselves, all right? To make sure that we're sensitive about those things. These folks didn't come out of somebody else's community, they came out of ours. All right, so I'm just putting it out there. We're not going to spend a lot of time on it, but it's something we just need to be conscious of. So the corrections thing is going up like this. The cost for holding folks and incarcerating folks, those costs are going up like this. And so those 3 categories, corrections, education, essentially basic education, and the Department of Public Welfare, and all of our assistance-related programs. That makes up, remember I said that 80%? That locks everything in. Okay? So now you have a situation where you got the rest of the 20% that's hanging out there that could theoretically be cut. You follow me now? That other 20%. Well, what is that money? Well, that's largely money. A lot of that money is money that goes to help young people go to college. Money that goes to Temple University to help them keep tuition rates down and help finance young people going to college, our young people going to college. Money that goes to the state system of higher education, the 14 Westchester and Cheney and Millersville and Kutztown and Indiana University of Pennsylvania, those 14 colleges, to help them go to college, or University of Pittsburgh or Penn State. There's money there. There's money that helps do economic development in our communities, okay? For example, in that category of that 20%, not the 80, but in that 20% is the money that we utilize to help build that wonderful shopping center down at 52nd and Parkside. Everybody likes that place, right? Well, it took state money to help make that thing go, okay? Money to help support, if you go over on the other side of the river, over at 4200 block of Wissahickon, the new Kroc Family Center by the Salvation Army. I don't know if you've been over there yet, but you need to go see that place. It's a wonderful place. We were very helpful in getting that place set up. Well, that money that comes from our Economic Development Fund, it goes over there. That money is in that 20%. Money for job training, money for community colleges, all right? Any kind of other money for arts and cultural organizations, okay? The money that goes to some of our arts and cultural organizations all around the city, all around the region, to help support them, to help them do what it is that they do, support the arts community. Money that goes to healthcare organizations that are not part of the Department of Public Welfare's litany of programs, okay? The AIDS money that you and I have worked with so hard on for over the years to get in, that's in there, okay? Money for diabetes control, money for drug prevention, all kinds of stuff like that. All those areas are in that 20%, all right? So that's the basic 80-20 mix. And I'm simplifying this because it is in great detail. And if you want to go into great detail, we can provide that information for you. You can see it on our website. We can provide that information for you. You can ask questions about particular areas of spending here, and we've got some good people here to help answer those questions. But when it comes down to the decisions that are going to be made, and this is why this is maybe the most important part of this conversation, is we're trying to share this information with you because, number one, it's our job to share it with you, all right? But number two, we want to empower you so that as the new governor comes in place, and he takes office on January 18th, 12:01 p.m. on January 18th, he's sworn into office up in Harrisburg. And the new legislators come in, and they take office on January 4th, the first Tuesday in January, somewhere around 12 or 1 o'clock. They get sworn in. That you communicate with them the importance of the programs that you provide and the services that you provide to folks. These are relevant programs that are needed in our communities to make our communities go. It's important because if we don't tell folks the deal, if we don't tell folks how important these programs are, if we don't provide an indication to folks the significance of these programs to our own neighborhood, but not just our own neighborhood, to the city, to the region, then what will happen is that they will be cut. Cut. Eliminated, scratched out, taken out of the budget. You won't see them again. Straight up. All right? And I'm not trying to do doom and gloom here with some false sense of some false reality. I'm telling you that we've never been in a situation like this in the history of the Commonwealth of Pennsylvania, with a deficit so large and an unemployment rate so large, with a new governor coming in who says, I'm not going to raise taxes. I'm not going to find any money from any other places to try to fill this budget problem. That we all need to live within our means. And we all need to tighten up our belts. And we all need to, our bootstraps. How's it go? Just pull them on, all that, He's moving into the mansion, okay? And we all need to tighten it all up. You understand what I'm saying? It is going to be a situation like that. And if we do not communicate to those of us who represent us, you can call me, but you already know where I'm at, all right? Okay? But to other folks in other forums, in other venues, the difficult reality that exists right now, if you don't communicate to other folks the importance of what it is that you do and the service that you provide, then very likely it will be on the chopping block. And you all need to be very clear about that. All right? This is real stuff, folks. These are real programs that have real impact on very real people that we all are responsible for. People we live with, people we work with, people that we service. All right? So that's why I wanted to get everybody together, to give everybody a sense of what's going on, and to make sure that folks take what we've got for you and spread it out there. And that you know up front, okay, what's going on. The governor gets sworn in on March 8th. A month later the governor gets sworn on January 18th and gives his budget address on March 8th. And right after that, there'll be appropriations hearings in Harrisburg. Okay? And we're going to be sitting around with all the departments and talking to everyone about what it is that they do. I can tell you right now that once this governor and the Republican-controlled Senate and the Republican-controlled House, once they figure out their program, and they're meeting trying to figure it out right now, and they're all coming to agreement amongst themselves, they're going to try to get on a racehorse to the finish line to do whatever it is that they can do to get out of Harrisburg, make the cuts that need to be made, not raise any taxes, and try to get this thing done and try to move so fast. Now, this is my prediction. Now, I've been wrong before, but I've been right before too, all right? And my predictions are going to try to move so fast, okay, that people won't know what happened to them. And by the time that folks start figuring, well, we need to go to Harrisburg. You know how we make those trips to Harrisburg? We need to go to Harrisburg. We need to talk to the folks in Harrisburg. It will be too late. So that's why I got you out here on the Friday before Christmas, in the cold, at St. Joe's University. Thank you, St. Joe's University. Thanks, St. Joe's. They fed y'all. All right? Thank you. Okay? So that we can be on the front end of this process, that you can be on the front end of this process and take this information back and share it with folks who need to understand exactly what's going on. This is real, folks. We've gathered together before in rooms similarly situated like this, all right? Some people would say we've gotten through this before, all right? I say we've never gotten really through it because when you cut, there's a person that's usually left without services. There's someone who's usually left waiting for some kind of help somewhere, and we've not been able to help them. All right? So we don't usually get through this. People will say, well, we'll get by. We'll get through. Everything will be all right. Well, you can say that because more than likely you'll get by. But what about those folks who don't have the strength and the capacity, who need someone else to help them get through? Okay? So that's why we're here today.